So, hello everyone, and welcome to the sixth episode of Diplomacy Talks with Samin. And in this episode, we have with us Mr. Jidni Mayukh, who is the current Vice President of IABC BRAC University, and he has also served as the Secretary General for BRAC University Global Modernity Nations 2020. Hello, sir. Welcome to the show.
Hello, Samin. Thank you so much for giving me the privilege of attending your amazing show. And hopefully I will be able to contribute to the topic that you have assigned.
Sir, it's an honor for me to have you with us. Before we start, can you please give a small introduction about yourself?
Right. Okay, of course. Just one little thing. I am currently the Executive Vice President, not just the Vice President, of IABC BRAC University. And yes, I did serve as the Secretary General for Global 2020. So introduction about me is that I have been doing Model UN since 2017. I started with BUP 117, and afterwards I have done around a combination of, let's say 25 or 26 Model UNs, both as a delegate and executive board member. And I've had the privilege of organizing my own conference. I was the head of the conference of that. But I primarily handled delegate affairs and academics. And as far as my executive board member experience, I mostly have been involved with United Nations Security Council. I have been a part of UNSC as a delegate and an EB a total of 19 or 18 times. I've lost count. So my area of expertise is knowledge is very, the scope of my area of knowledge is very limited, if you may say. Other than that, I am currently studying computer science engineering at BRAC University.
So we will simply jump on the topic right now. That's New Zealand beating COVID-19. So sir, can you please give us a brief how New Zealand is actually tackling with this situation and how they have been able to keep this record so low?
Right, okay. So when you first assigned me the topic, and immediately like, yes, because ever since New Zealand it's been all over the news, right? New Zealand has been so successful in handling the situation regarding COVID-19. I started doing more research on New Zealand a couple of months ago because I'm planning to do my master's over there. The University of Auckland, it's a very prestigious place, and hopefully, inshallah, let's see what happens. So let's dive right into the topic. So before we begin, I have to say a couple of things. One of them being is, whatever New Zealand did, I will not necessarily compare it with other countries, because New Zealand as a country, they had a couple of things in their favors, and they took some steps which would not be applicable elsewhere, logically speaking. So from different countries' perspectives, what New Zealand is it implementable or not? I will not necessarily go into that, perhaps at the end, but I'll go over what are the key factors that led to the huge success of New Zealand containing the COVID-19 situation. So if you look at what exactly happened, I guess New Zealand first reported case was in February 28th. And in 1 month later, in March 25th, they went into lockdown. So it's they took around 25 or 28 days to go into the lockdown scenario. But the best part about New Zealand, and this is the most important part, that they are incredibly fast decision makers. And in a situation like this, when the lockdown, the outbreak started to happen, scientists, all medical professionals kept saying that you need to close down your borders, you need to start the lockdown process, but countries were not listening. It's not an easy thing to do, is it? Because think about it, your entire economy is about to be shut down. And for any government to take that huge step and make a plan centering around that, it's going to be very, very difficult. But New Zealand did that excellently. So the first key factor is that they were very quick decision makers and they were on their feet. Now think about it like this. And I'm going to give a quote of the Director General of the Health Assembly of New Zealand. His name is Ashley Bloomfield, I assume. I'm sorry if I'm pronouncing it wrongly. I just read it on the internet. And he said that implementing this type of plan would have significant economic costs. but a major outbreak will have even greater costs. So when a leader of your ruling party or government says something like this, it means they have incredible foresight. They are aware of the situation and the ramification of their actions. And whatever decisions they take, they know that either way there will be consequences. They just weighed out which one is going to be less catastrophic for our country. And the decision they took, it basically wowed the rest of the world. And this foresight was missing in a lot of people and throughout the world. Can I actually take this decision of shutting down or going into lockdown, shutting down cafes, shutting down businesses and restaurants? And how will I cope with the economic catastrophes that are bound to happen if this continues for a prolonged period of time? So they had foresight, they had quick decision making. And one more thing that played into their favor is they had a very good pre-existing system. You see that New Zealand, first of all, it's a very high income country. People have a good standard of living. They have a very advanced healthcare system. And I didn't know this. Every single person the basic level healthcare is covered by the government. You don't have to pay. On top of that, there are private systems available, but most of it's covered by the government. And more importantly, it's an island-based country. So even if an outbreak was to happen, since it's a combination of many islands, it didn't necessarily mean that the entire population would be at risk immediately. So these couple of things were already in their favor. And on top of that, they already had a pandemic framework. It was primarily framed for the influenza flu and a couple of small other outbreaks that may happen, like measles or smallpox. And there was a pre-existing framework. People already knew that there were alert levels, alert level 1, 2, 3, and 4, 4 being the lockdown stage. And these things all came into play when they actually took the decisions of locking everything down. You have to keep in mind that other countries also had a conventional or orthodox method of going to lockdown or preventing biohazards like this. But New Zealanders were the first one to realize that if we follow the conventional way, things may not work out. Because even though they had the influenza pandemic potential framework there, they did not go to it like word for word. They made significant changes according to the data and evidences that were provided by the World Health Organizations. They made all the necessary modifications, and then they implemented it. Why? Because this pandemic is unlike any other. You cannot compare the situation with anything else. So the government in charge, they were aware of every single thing that could possibly go wrong. And that eventually resulted in a result that is incredible. They, instead of flattening the line, they say they have crushed the line. So they crushed, in flattening the curve, they have crushed the curve, which is amazing. So let's go over what we spoke. First, fast decision-making, good foresight, pre-existing system. And these things, okay, are definitely important. But one more thing is they properly utilize what technology has to offer. The world, as we know it, is currently entirely governed by data. Data rules everything. It is considered even more a powerful resource than oil by some. And oil is pretty powerful, especially if you are doing model UN, you would know. So utilization of data, evidence, that evidence-based approach, initiating, starting from where the first case was, whether they could track it or not, constant risk assessments, outbreak updates, technical guidance from WHO. They utilize all of these data analytical tools, and they centered their decisions based on those data. And that is a key factor, I guess, a lot of countries could not capitalize on. So when it comes to controlling an outbreak like this, the first thing any country should have done, or technically did try to do, is to control the situation by mitigating the panic that is spreading, right? So think about it like this. It's all over the news. People are dying. and people are getting infected. People are saying that there is no cure. We don't know what's going to happen. It's evident that you will start to panic. And panicking is not something that is out of, it's something that comes naturally, right? So how did they control this panic? And here's where the prime minister or the local leaders or the leaders of the particular ministries came into play. Every single one of them ran a particular communication campaign with consistent and clear messaging. This is something that we can handle. Just stay inside. And the message that they gave, they basically said, we are an army of 5 million people. They consider the entire New Zealand population as one. A clear message that we are together. Every single one of them conveyed that message. Every single news channel, every single paper, even opposition political parties, everyone was on board. Suppliers, distributors, essential workers, everyone knew the clear message. And this communication campaign is perhaps one of the greatest communication campaigns in history, in my personal opinion. Because doing something like this, one takes planning, and second takes a lot of intricate decisions that needed to be properly integrated together. And they did perfectly. They did that perfectly. And one part I love about them is they use Facebook a lot. Facebook Lives or podcasts. You see anything happens, you'll find Jacinda Ardern coming live and speaking about it. Any good news, and sometimes even bad news, she will let her people know that this is what happened, we are sorry, we will take actions, or this is what happened, we're happy. See, even after they, as people say, that they crushed the curve, 1 or 2 new cases were found, and guess what? From my perspective, I would assume normal countries would 2 more cases, it's completely fine. We eliminated the rest. They would react like that. 2 more cases, I can still contain the situation. But what did they do? Immediately came into public, sincere apology. You can see it in their agenda. We are extremely sorry. We apologize. We are again trying to trace the source of the infections, and we're going to handle the situation properly. And they took accountability and responsibility. They did not blame it like on something else. Perhaps they could have, they could have even hidden the news, as far as I care. But there's this touch of sincerity in everything they do. And these are some of the key factors that led into New Zealand now achieving this huge success. It's not just the people, it's that the entire nation was together when basically other nation could not do. And you see, when your worst enemies are also working with you to solve a problem, you understand that this is something that other countries, let's say if I'm talking about United States of America, even if the governments were trying to do something, anti-government parties were spreading another different message, and there were lots of chaotic situations. And this thing, is it really expected of them? Perhaps no. But did New Zealand do it? Yes. And do they have the results? Of course, you can see that. So they stood out in these couple of areas: decision-making, foresight, pre-existing system, utilization of data, and a mass communication campaign. And one last thing, although this is not very popularized, New Zealand care about the indigenous people a lot. We have the Maori population, and they are a big part of their culture. So if something were to happen to them, let's say an outbreak breaks into one of their islands or something, it's going to be catastrophic for them in terms of culture, in terms of heritage. And they took that into consideration. Immediately they started communicating with them, training them remotely. And these are just a couple of subtle moves that eventually added up in the long run. And New Zealand is what it is today. Basically a country with a very accountable government and very kind and generous people. And the message that Jacinda Ardern said at the end of the press conference or press release that happened after it was reported that New Zealand has no active cases is that, thank you, New Zealanders. That is how she ended her speech. A big thank you to her population, meaning the population cooperated as well. So these are some of the key factors I believe was missing in a lot of countries. So even if one element goes missing, the entire thing does not work. If you do not have proper data-based evidences, how are you going to implement your frameworks locally in different districts or different islands? It's not going to work. If you do not have a proper communication campaign, how are people going to know what they have to do? If you do not have foresight, if you are not aware of consequences of your actions, how are you going to balance out different decisions? Do I take this decision or do I take that decision? So all of these things, if you add them together, they basically form the perfect knot. And that is why New Zealand is what it is today. And hopefully I will be able to go there 2 years from now for my master's degree.
Well, sir, you said that New Zealand had applied a lockdown from the very beginning, where other countries didn't. But sir, at the beginning of this year, when China had very few cases, they had warned everyone that this could lead to a pandemic. If New Zealand could have a lockdown in effect, then why the other countries didn't take that warning from China as a precaution that they should be having a lockdown very soon?
But, that's an amazing question. It is true that China gave out a warning, but other countries did not take it. So say, for example, Italy. 1 week, okay, fine. Second week, couple of cases. Fourth week, cases increasing. 2 months, the entire country is down to their knees. Literally, European giant country, the entire economy shuts down. And I remember reading a statement like this from the Prime Minister, is that I think it went something like that. The people of Italy have sacrificed a lot for their nations, and Italy will sacrifice itself for its people. And that's a very strong statement and a sad statement as well. So I'm going to break down your question into 2 parts. First, let's see when New Zealand actually started lockdown. First case was in February 28th. They went to level 4 in March 25th. Okay, so it's around a 20-day, 22-day period. Their cases started to increase around mid-March, March 16 or March 17. That's when they started to realize, I cannot trace where the source of infection is coming from. That was a defining factor. Since they relied on data a lot, they could not trace, okay, where this person particularly went, the contact tracing as we call it. And in that scenario, the government quickly took the decision, okay, now we have to do this. And the World Health Organization cites this as early and hard action to tackle COVID-19. And basically, they rigorously adhere to public health guidance. They increase the number of testing. Even the testing facilities were pre-existing before the lockdown started. Okay, so when they saw that, okay, we cannot trace it, they increased the number of testing facilities. They increased public service announcements, and it was a very hard decision to take, but those factors, again, foresight, decision making, and data-based evidence, and that eventually led them into going into lockdown. And see, when other countries, let's say for Italy or for Spain or for Sweden, for example, Sweden is a country that, let's talk about Sweden. Sweden had a huge number of cases. Now, if you consider Swedish education and New Zealand people's education and lifestyle, it's pretty high up there, right? They have a very lavish lifestyle or high income lifestyle, and they're aware people. But almost the entire population was 23,000 or 25,000 people, I think, or more people got infected in Sweden, and an incredibly high death rate compared to New Zealand. Why? Because the government did not actually think that this would happen. They announced a couple of announcements such as stay away. They banned public gatherings of 50 people. But they did not close down restaurants. They did not close down cafes. They did not close down the cinema halls. And it basically boils down to that. Am I properly tracing the contacts? If yes, I go into lockdown. If no, things stay as it is. When Sweden saw that they were unable to trace where the source of infection is coming from or how it's spreading, they were not able to visualize it using data. Perhaps they should have gone into lockdown, perhaps other countries should have. And that is the defining factor. When I don't know what's going on, it's better to not do anything. If I know this is where it's heading, then I can stop it. And New Zealand, at first, it seemed like it was not working, but eventually it did. When they went into lockdown, the number of daily cases, it was on the rise. But eventually, it kept coming down. When it comes down, you realize that lockdown is working. A lot of other countries, they went into lockdown, the number of cases were not dropping, meaning the lockdown was not working. These things happen. And I guess there's nothing we can do about it. What happened, happened. If we dwell in the past, then I don't think any country can improve. Currently, we are in damage control situation, and I'm not an economist, but I can assume there will be very bad economic consequences and catastrophes upcoming. But let's see, the countries are working in solidarity. There are UN guidelines there. The governments are collaborating to a certain extent. Then hopefully there will be light at the end of the tunnel.
So New Zealand has obviously done an amazing job being able to keep down the COVID-19 cases low. So sir, we will end this episode with one last question. How do you think that other countries can learn from this? How can other countries implement or take knowledge from New Zealand in tackling this situation?
Okay, so that's again a very good question. So if the world is not a small place, when you say how do you think other countries can do it, what are we talking about? Are we talking about Middle Eastern countries, or are we talking about South Asian countries, or are we talking about Russia or Europe or North America? So different geographical areas, based on different geographical areas, the answer will be different because the people are different over there, right? So I cannot necessarily say how can they implement New Zealand's model. They are basically a role model for others to follow. So they followed the orthodox way, but they made some modifications. They followed WHO guidelines. They properly mass communicated it. They had accountability. The government came forward and communicated with their people. If you look at Belarus, I'm sure you will find that their case is very funny because that's an entire conversation for another day, but I urge you to do research on that. So if governments are accountable, if they admit, okay, no, we messed up, things could have been done, handled better, but this is the situation now, and let's work together with the people and handle the situation. And I'm going to give you one quote, and this applies for humans as well. And I absolutely love this line. And when you consider this from a bigger perspective, you can apply this to countries. You can particularly apply this to this situation. You can apply this in your personal life. You can apply this in your professional life. You can apply this wherever you go. And it goes something like this. To have the results very few have, you have to live like very few do. If you think about it, only a small percentage of the entire world population is considered conventionally successful, 2% to 5%. Why are those people successful? Because they live in a particular, they do certain things that normal people do not do. So let's say, for example, waking up at 4 a.m. or let's take Elon Musk, for example, working 120 hours a week. They live a certain lifestyle that normal people do not do. This is why they have a very different result. And from a country perspective, same applies. If you want to have results like New Zealand, you have to take very strict decisions like New Zealand. That's shutting down everything, communicating messages properly, utilizing data, and caring about the people, being sincere about it. That's one of the defining factors. Because I do not know, apart from Justin Trudeau and the Sindard, and I don't see any other government leader coming live and speaking to their people. But Justin Trudeau is famous for very different reasons, perhaps his good looks, but she is an amazing lady where even if a small thing goes wrong or goes right, she will come forward to her people and let everyone know that this is the situation we're doing this. And that, at the end of the day, I think is a defining factor. If you can trust, if you have trust established, the rest will follow.
That's pretty much it for the video. Thank you very much for being with us.
Thank you so much, Samin, for inviting me, and I really enjoyed myself. Hopefully I did not take too much of your time. One last thing I would like to add, and this is going to take 30 seconds, is even if when New Zealand saw that results were coming down, even when they were successful, they did not let complacency creep in. They did not take it easy. Okay, we've eliminated it, let's take it. No, they kept up they are preparing for the worst. They have increased their healthcare measures. more testing, more messages. And that's basically something that we all need to take into consideration. Even if everything is going well, have a backup plan. Do not get complacent that it will not have. Don't take it for granted. And that is also something New Zealand handled pretty